Good morning, my fellow teammates and all the audiences that I appreciate who will watch this presentation. On this blissful occasion, we from the small group discussion, B3 group would like to present our student project entitled Clostridium Difficile Infections or CDI. But before moving forward to the next plan, let me introduce all members of this group which is shown in the slide. For the first speaker, time is yours.
My name is Putu Sri Dianingsih and my three last digits for my student ID is 070 and I will start the presentation. So CDI is an infection caused by Clostridium difficile bacteria because of the improper use of antibiotics and still uncommon in developing countries. In a study conducted at Dr. Sutomo Hospital to analyze CDI in diarrhea patients who received antibiotics, only 1 from 31 samples showed positive. Even so, CDI should not be underestimated and it is necessary to do antibiotic side effect examination to prevent similar cases. Next slide. So the problem formulation of this student project is what are the definition of Clostridium difficile and Clostridium difficile infection, epidemiology, etiology, risk factors, pathogenesis, diagnosis, differential diagnosis, management, complications, prevention, and the prognosis of Clostridium difficile infection. Next slide. Okay, so the purpose of the student projects is to explain about the definition of Clostridium difficile and CDI, epidemiology, etiology, risk factors, pathogenesis, diagnosis, differential diagnosis, management, complications, prevention, and the prognosis of Clostridium difficile infection. And the last one is benefit. We sincerely hope that this literature will give a great insight about CDI and contribute to the improvement of CDI knowledge. So the next presentation will be continued by my colleague.
Greetings everyone, my name is Joanna with the last 3 digits of my student number 079. This time I'm going to explain about what is the definition of Clostridium difficile infections. But before that, we need to know what is Clostridium difficile. Clostridium difficile or C. difficile is a gram-positive anaerobic bacillus that forms endospores under extreme conditions the bacteria cannot withstand. It is widely present in the intestinal tract of humans and animals as a normal biota. Next please. Now, Clostridium difficile infections, or CDI, are enteric infections caused by the spore-forming bacteria Clostridium difficile. CDI is spread through feces that contain C. difficile spores. CDI is the most common cause of antibiotic-associated diarrhea. Humans typically develop diarrhea induced by C. difficile during or shortly after receiving antibiotics, but symptoms may occur months after the initial infection. Signs of CDI include dehydration, watery diarrhea, and in extreme cases, peritoneal signs may be present. Next, please. Next, I'm going to explain about the epidemiology of CDI. Now, CDI is associated with substantive morbidity and mortality across the world, which makes it the leading cause of healthcare-associated infections, or HAIs. One global literature review found North America to have the highest rates of CDI cases. In the United States alone, almost 2/3 of the cause of the estimated 500,000 infections in 2012 is related to inpatient care. The epidemiology of CDI has not been precisely studied in Asia, specifically Southeast Asia. In Indonesia, CDI cases have very low reports, but its prevalence compared to neighboring countries is reasonably high. This reasonably high prevalence of CDI in Indonesia may be prompted by inappropriate antibiotic prescription and use, along with free access to antibiotics without prescriptions. The next part of this presentation will be continued by my colleague. Thank you.
Thank you for the time. My name is Wayan Ariawan with 073 as the last 3 digits of my student numbers. Now I will discuss about the etiology and risk factors of Clostridium difficile infection. So Clostridium difficile is widely present in the environment and is also present in the stomach, suppressed by the gut normal flora. Clostridium difficile infection occurs when the gut normal flora which suppress the Clostridium difficile are altered by antibiotics, causing overgrowth of Clostridium difficile. As for the risk factors, there are acid immunosuppressant therapy, poor immune system, previous infection experience, malnutrition, past healthcare exposure, and chronic liver and renal disease. And as for the risk factors for recurring, there are advanced age and hypervirulent strain. That's all from me. The next will be discussed by my colleague. Thank you.
Hello everyone, my name is Natasha Putri with 083 as the last 3 digits of my student number. This time, I will explain about the pathogenesis of Clostridium difficile infection. The first stage of the pathogenesis is the spores of Clostridium difficile infection transmitted to human. Stage 2, Clostridium difficile begins to dominate and colonize the large intestine when the balance of gut microbes is upset. Stage 3, toxins and enzymes are damaging the skeleton of epithelial cells, disrupting tight junction, and causing fluid secretion, neutrophilation, and localized inflammation. Stage 4, toxins that have bound to the receptor are endositized and acidified. Stage 5, toxins then are transported to the cell cytoplasm, where inactive family of GTPases is. And the last stage, protein inactivation, causing the inflammatory process intensifies. So that's all from me. The next material will be brought by my friend. Thank you.
Hello, my name is Putu Chandrika Rahma Dewi with 071 as the last 3 digits of my student number. This time, I'm going to explain about the diagnosis of Clostridium difficile, including the clinical manifestation and examination. Okay, the major clinical manifestation of Clostridium difficile is the presence of toxin A or B, which are pathogenic. However, there are other general clinical manifestations that can be used to make the diagnosis, such as diarrhea, which accompanied by stomach discomfort, fever, hypertension, and shock. Patients with clinical symptoms can be divided into 3 categories. The first, patients with mild-moderate illness will experience diarrhea as well as signs of colitis, such as fever and stomach pain in the lower quadrant. In severe illness, laboratory abnormalities including the presence of lower leukocytosis and the serum creatinine level is less than 1.53 times of the primordial level. Fulminant Clostridium difficile occur in 5% of patients and is characterized by the severe abdominal pain, profuse diarrhea, or in some cases, no diarrhea and the development of an ileus. In order to analyze the clinical manifestation, supporting examination is used for Clostridium difficile detection, including toxigenic culture, cytotoxicity neutralization assay, enzyme-linked immunoabsorbent assay, for toxin A and B, glutamate dehydrogenase, and nucleic acid amplification assay. Okay, that's all for me. The next will continue by my colleague. Thank you.
Okay, thank you for the time. I am Wulan Trianti with 3 last digit numbers, 86, and I will deliver the chapter 2.6 Differential Diagnosis. An important component of the successful management of Clostridium difficile infections, or CDI, is a prompt and accurate diagnosis. 50% to 25% of all cases of antibiotic-associated diarrhea, which can range in severity from mild diarrhea to fulminant pseudomembranous colitis, are caused by this illness. There are several differential diagnoses that need to be concerned. First, Crohn's disease. Crohn's disease is a disorder of the intestine that causes chronic intestinal inflammation. Uneven and transmural lesions can affect all digestive tract from mouth to anus are typical symptoms of this disease. In addition, abdominal pain and diarrhea that can seriously affect the quality of life of patients are also other symptoms. Second, diverticulitis. Diverticulitis is inflammation due to perforation of the microdiverticulum, which is a pouch-like projection from the wall of the large intestine. Also, diverticulitis usually occurs uncomplicated, but it is usually associated with abscess of formation, fistulate bowel obstructions, or obvious perforation when acute diverticulitis occurs. Third, irritable bowel syndrome or IBS. If there are no other causes of illness, IBS is defined as abdominal pain or simply discomfort from frequently changing bowel conventions. Symptoms can be controlled with a variety of drugs and non-pharmacological agents, but with regards to IBS subclass. Fourth, malabsorptions. Any defect that occurred in the process of human digestion or absorptions can cause malabsorptions, which can be caused by disease attached to the mucosa, the intestinal membrane transport system, impaired absorption of the specific nutrients, impaired GI motility including decreased peristaltics and static disruptions of the bacterial flora, infections, or impaired blood and lymphatic flow. Fifth, peritonitis and abdominal sepsis bro. Bowel inflammation and anti-inflammatory manifestation in the body will provide a response as a result of a host pathogen interactions with excessive inflammation resulting in collateral tissue injury. This response is called sepsis, which causes an increased susceptibility to secondary infections. To the next speaker, floor is yours.
Thank you for the time. My name is Nathanael Monika with 077 as my 3 last student number digit. I'm going to continue the explanation with the differential diagnosis. Salmonella infection, salmonellosis. Members of the Salmonella genus are renowned for their ability to infect a variety of hosts, including pigs, which are often a cause for concern. Pigs can be infected with various Salmonella serotypes, which have the potential to contaminate pork products and pose a threat to human health. Shigellosis. This infection caused by Shigella can occur in all age groups, including the very young to the elderly. However, this infection is very risky in people who have immune disorders. Just a few bacteria can cause watery or bloody diarrhea in addition to causing high fever, vomiting, and diffuse colic abdominal pain. Ulcerative colitis. This disease is characterized by limited inflammation of the mucosa and submucosa of the large intestine. In general, the rectum will extend proximally, continuously, which is the beginning of the start of the disease. Viral gastroenteritis. This disease is usually self-limited but can have significant morbidity in both the young and the elderly. However, viral diarrheal diseases also cause significant mortality, especially in infants. Colorectal malignancy. The second most lethal cancer for both males and female combined is colorectal cancer, CRC, which is also the third most frequent diagnosis. Colorectal cancer's symptoms can vary depending on where the malignancy is located and can include modifications in bowel movements such as persistent diarrhea or constipation, appetite loss and weight reduction without a known cause, anemia, which is an exceptionally low quantity of red blood cells, and many more. Appendicitis. Vermiform appendix inflammation is referred to as appendicitis. It usually manifests abruptly within 24 hours of start, although it can also show signs of being more chronic. Any one of the symptoms listed may or may not go together with pain. Nausea or vomiting, fever, diarrhea, anorexia generalized ill feelings, and frequency or urgency of urination. Next will be continued by my colleague.
Okay, thank you for your time. Let me introduce myself first. My name is Ekaputra Tanuwidjaja, with the last 3 digits of my student number being 084. And I'm going to continue with the topic of management. So in general, management can be split into two, which is surgical and medical. Let me start with surgical. So fecal microbiota transplants, or FMTs for short, is the most common type. And FMTs in general are a type of colonoscopy, and it's usually operated on patients who have suffered more than 3 recurrences of the infection. And when compared to medical management, it has an extremely high resolution rate, and with a percentage around 92%. Some known side effects of FMTs post-surgery include abdominal discomfort and cramping. And most of the deaths reported after a person has done the surgery is most likely due to unassociated complications that are not related to the infection. So next we have medical management. So most medical treatments stem back to antibiotics, and these antibiotics, which are metronidazole, vancomycin, and fidazomicin, are scaled by frequency of recurrence and severity of the infection. So metronidazole is used to treat patients who have experienced moderate severity and are usually treated on first-time patients, while vancomycin and fidazomicin are used to treat patients with severe symptoms and usually with more than one recurrence. Some known side effects of these antibiotics, most prominently metronidazole, include nausea, abdominal pain, diarrhea, neuropathy, neurotoxicity, and encephalopathy. That's all from me. I'll let my colleague continue. Thank you very much.
Okay, let me introduce myself. My name is Putu Sri Partha. The last 3 digits of my name is 080. Okay, I will explain the complication of CDI. CDI has a potential to cause life-threatening complications. Some of these complications are sepsis, which is a hyperimmune host response to CDI. Sepsis will cause systemic inflammation that damages vascular endothelial tissue and organs, leading to multiple organ failure. Sepsis can also cause septic shock with a mortality of 40%. CDI also has a potential to cause complications associated with colitis, including toxic megacolon and colon perforation that caused by necrosis of inflamed tissue colon. Both of these complications are treated with a colectomy procedure. Okay, that's all for me. The next material will be explained by my friends. Thank you.
Hello everyone, my name is Gabriella Ferenina with 081 as the last 3 digits of my student number, and now I'm going to explain about prevention of Clostridium difficile infection. The first one, we have to wear protection, wear disposable gown and gloves during contact with patient. Next, we have to wash hands, use water and soap, and avoid using alcohol hand gel. Number 3, we have to use single room for patient, and if it's not possible, contact with others should be limited. Fourth, we have to clean surfaces because Clostridium difficile spread through surfaces around patient. Fifth, we have to limit using antibiotics. And 6, we have to receive monoclonal antibodies injection. That's all from me. The next one will be continued by my colleagues. Thank you.
Thank you for the time. my name is Yudhaswara Viryavan, with my last 3 digits of my student number is 069. In this next occasion, I would like to tell about the prognosis of Clostridium difficile infection or CDI. As a bacterial infection, CDI can result in a variety prognosis for those who contract it. Once the course of therapy is over, there is a little change of the infections returning. In general, infections individuals with Clostridium difficile have a 1 in 6 chance of contracting the illness once more within the next 2 until 8 weeks. The presence of the numerous comorbids and older age were the 2 main risk factors of SCDI. In community, CDI is now recognized in younger and healthier patients, and the doctor have an important role here. Doctors may be better able to decide on the best course of therapy if they are able to identify predictive marker for SCDA or RCDI. That's all from me. For the next speakers, the time is yours.
Hello everyone, my name is Sara Putri Bungaran, S078 as the last 3 digits of my student number, and this time I'm going to explain about the conclusion of the student project. Clostridium difficile spores can cause an enteric infection called Clostridium difficile infection or CDI. Clinical manifestations for Clostridium difficile are diarrhea, advanced age, significant leukocytosis, reduced blood albumin, and increase in serum creatinine and comorbidities. There are several differential diagnoses such as Crohn's disease, diverticulitis, malabsorption, etc. The use of metronidazole, vancomycin, and fidaxomicin as antibiotic is a medical treatment for CDI, controlling modifiable risk factor and prioritizing hygiene and environmental clinical are several things that can be done to prevent CDI. Clostridium difficile infection is an infection that occurs in several regions of the world. However, in Southeast Asia itself, especially in Indonesia, there are not many cases of CDI. However, it doesn't rule out the possibility that CDI actually occurs a lot in Indonesia. In Indonesia, there is no requirement to identify the presence of this bacterium, and research on CDI cases is still low. Given several things that can be the factor of CDI risk, further research is needed so that the public can implement prevention and achieve national health, such as by not consuming antibiotic carelessly and maintaining personal and environmental hygiene. And that's all from me. Thank you.
That's all from our presentation about our student project. We would like to apologize if there are any mistakes we made during this presentation. And thank you for your attention.